and today I'm hosting Cash Cab Med Micro Edition. Today we're going to drive around campus and see if we can find anyone who's willing to participate in our game and see if they can answer questions about Group B streptococcus. The way we play this game is I will drive around campus and I'll see if we can find participants, and they will have to answer a series of very tough medical microbiology questions about this disease. The contestants in the game have 3 strikes, and once they get 3 questions wrong, they're kicked out of the cab. However, if they're stumped, they can phone a friend or they can try a street shout-out to someone here on campus. So, let's see if we can find someone to play the game. Congratulations, you guys are on Cash Cab. It's a TV game show that takes place right here in my taxi. What do you say? Want to play?
Yeah. Sure.
First question of the game. What are some common symptoms of neonatal meningitis?
Fever, vomiting, and severe headache.
That's correct. How does it avoid the immune system?
It invades a chronic epithelial cell or a pre-existing cell.
2 for 2. Meningitis was found in patients with glucose concentrations of 0.67 grams per liter or less.
I think that's false.
That sounds right. False?
False.
Correct. After birth, a newborn can contract neonatal meningitis. What is the genus and species name of this bacteria?
I think it's a streptococcus.
Streptococcus agalactiae?
Wow, that's correct. You guys have answered 4 questions right, and now we're stuck at a red light, and that triggers a red light challenge. Here's how it works. It's a multiple answer question, and you must give all the right answers in order to receive all the money. So, the red light challenge question is, what are 4 ways in which neonatal meningitis can be prevented?
Something about screening.
I think pregnant women have to be screened at week 35 of pregnancy. C-section birth is preferred over natural birth.
Antibiotics in labor.
Make sure that everything's sterile and
The nursery for the newborns.
yeah, good hygiene.
Yeah.
You guys just won the red light challenge. Next question. What kind of a cell wall structure does the Group B streptococcus bacteria have?
It's either gram-positive or gram-negative. Gram-positive?
Final answer?
Final answer.
Yep.
You guys are correct. How does Streptococcus agalactiae attach to the host cell?
I have no idea.
I don't know. Velcro, I guess.
I'm sorry, but that's incorrect. That's your first strike.
Dang.
The correct answer is that it binds to the fibronectin, fibrinogen, and laminin proteins on the vaginal mucosa. What damage does this bacteria cause?
We're not sure. Can we do a shout out?
Sure. Would you like to use your call, or would you like to find someone on the street?
Let's do a call.
Okay. Who are you going to call?
My biology teacher from last year would probably know, Dr. Keys.
All right. Well, then let's call Dr. Keys.
All right. Hey, Dr. Keys?
Yes?
This is Shayla Siefker. Me and Robin Stabler are on Cash Cab right now, and we have a question for you.
Oh, sure, go ahead.
What damage does the bacteria that causes neonatal meningitis do?
I think it compromises the barrier between the blood and the brain. It also kills the other cells, and it excretes an enzyme that degrades the connective tissue.
Okay, are you sure?
Yes, I am.
All right, sounds good. Thank you. Okay, we're going to go with that.
Well, you guys definitely knew who to call. That's right. What is one of the drugs used to treat neonatal meningitis?
Ampicillin. Does that sound right?
Yeah, that's
Okay.
an antibiotic.
Yeah, let's go with ampicillin.
That is actually correct. But there are also other antibiotics used to treat neonatal meningitis, such as gentamicin and cefoxamine. What form of transmission is most common and occurs when the GBS bacteria colonizing the vagina is passed to the baby during passage through the birth canal?
Early onset transmission? That
That sounds right. Early onset?
Yeah.
Early onset transmission is correct. Okay, so the next question is, all symptoms must be present in order to have neonatal meningitis. True or false?
True? True? True.
I'm sorry, but that's incorrect. The answer is actually false. That gives you guys your second strike of the game. One more strike and I'm going to have to kick you out. Alright, so this brings us to our last question of the game. If you answer this question correctly, you guys will win the grand cash prize. But if you get it wrong, it'll be your third strike and I'll have to kick you out of the cab. So the final question is, what is one test that can aid in the diagnosis of neonatal meningitis?
Can we use our shout out?
Okay, the shout out you have left is to find someone off the street. So when you see someone that you would like to help, just call them on over.
Hey, excuse me.
Yes.
Can you help us?
Sure.
This is a game show called Cash Cab where these contestants are trying to answer questions about neonatal meningitis and to win a grand prize. Alright, what's your name?
Dr. Rodney Anderson.
Okay, well, Dr. Rodney Anderson, here's the question. What is one test that would aid in the diagnosis of neonatal meningitis?
I think I'm going to say CSF gram staining.
That sounds right.
Yeah.
Is that your final answer?
That's our final
Yeah.
answer.
Wow, congratulations guys, you just won Cash Cab. Okay, well we've made it to your final destination. You can either take the grand cash prize of $24.06, or you could stick around and risk it all on a bonus question for the mysterious bonus prize.
$24.06 is a big wager. I don't know.
Yeah.
I'm curious about the bonus prize. Let's
Yeah.
go with the question. Let's try it.
So, your bonus question is, what is always in Dr. Anderson's mysterious black bowl besides his expo markers?
Dr. Pepper.
Yeah.
You guys are correct. You guys have just won the cash prize and the mystery prize, which is a Diet Dr. Pepper. Congratulations.